I just can't tell if I'm doing it right.
Let's have a look. Maybe he's not hungry.
But he must be.
We'll try again then.
I think he's latched on now. Ow, it really hurts.
Well, it'll get better. Here, have some more water.
Oh, he's come off again.
Why? What's wrong?
I can't do it.
Oh, yeah, you can. Come on.
Barbara, you'll be in here today. Please feel free to rearrange if you want things a little less full.
Yes. Let's see what we can do in here.
That's a lot to carry around.
Oh, it's just my bits and bobs.
Barbara, have we met?
This is the first time I've run the support group.
No, somewhere else.
Did you ever work at Birmingham Central?
Yes, ages ago. I did a student placement in the maternity ward. You were a midwife.
For 12 years. I've been a lactation consultant for 7 now. Better hours.
Right, well, I'm running the baby clinic, so if any of your women have a medical problem, feel free to send them in.
Thanks.
I don't have to be back in Edinburgh for a few days, so I was thinking I can hang around here until then. If it's okay with you.
It's okay with me.
What?
Nothing, I just can't really get over it, you know? Last time I saw you was on Candlein Beach, and now... How did you find me?
A good journalist never reveals his secrets.
Oh, go on, I'm intrigued.
Actually, it was the Primary Care Trust that gave me the surgeon's address. But I nearly didn't come.
Why not?
Because it was a holiday thing, right?
Right, yeah. Yeah, I thought the same thing, too. So what, you're just passing through?
No. I couldn't get you out of my head.
I couldn't get you out of my head either. I tried calling you, but...
Then we have something to celebrate. Now you're going to tell me you have to go to the office.
Oh, I wish I didn't have to. But after Friday, I've got some apologizing to do.
It was just a kiss, for heaven's sake. You've been going on about it all weekend. I don't see why you're still so annoyed.
I'm not the issue. The waiting room could have been full of patients. 2 grown men in a clinch. What did I do with those notes from Friday?
Would you have felt the same if Greg had been kissing a woman?
Julie, I'm not a bigot. It was unprofessional, totally inappropriate. And that's the end of that. This is what I was looking for?
Yes, ma'am.
Oh, here he is.
Morning.
Don't you walk past me. What about Friday? What happened with Rico?
Sorry, babe. I've got to see Mac.
Oh, he looks so happy, doesn't he? I'm dying to find out.
So am I, after what you told me.
What do you mean?
Well, they were head over heels in Goa, but it turns out he and Rico decided to call it a fling. You could tell he was devastated when he came back from holiday.
I didn't know anything about it.
Nick, what happened to you?
Oh, no, don't say we're going to be a doctor down.
No, it's nothing. It's just a mishap.
Yeah. Oh, you're here. That's something, I suppose.
Mac, listen, about Friday.
Yeah.
Before you say anything, just let me apologize. What I did was completely unacceptable. I was totally and utterly in the wrong.
Yes, you were.
And I'm sorry that I lumbered you with all my patients. It won't happen again. Great, so if everything's okay, I'll get on.
Actually, Greg, everything isn't okay. Supposing there had been patients in the surgery.
Well, they weren't, were they?
Did you check, or was it just luck?
Mac, I'm sorry.
Greg, it was unprofessional.
Hang on a minute.
You're a partner in this practice. How can I trust you to behave appropriately in the future.
This isn't something that I hide from anyone, Mac. I fail to see how trust comes into it.
One of the partners kissing another man in the middle of surgery. How do I explain that?
To who? The bigots of Leatherbridge?
Oh, come on, it's not...
It's not what, Mac? It's not what? Tell me.
We were on Cloggy. We just made our first proper pitch. And suddenly, there's this guy, a scrambler, about 4 meters above us, tackling a slabby corner. So I shouted out to him, do you realise this is a VS climbing slope?
Well, what was he doing there?
He'd lost his line. Anyway, I'm the nearest climber. I can see his mate's too far behind. He's lost his rope, and there's no way he's going to hold on.
Sounds like that movie.
So I've climbed up to him. I've placed my foot so he can use my ankle as a handhold. But the rocks must have been loose, because he slipped. Now he's dangling like a 4-minute, and I'm holding him as hard as I can. But he's going.
Don't say he fell.
He's slipped to the ledge. He's broken his arm. He's in agony.
So what happened?
I called Mountain Rescue.
Excuse me, where do I go for baby clinic?
You're with me. I'm Dr. Croft. You can bring your pram through here.
So, what happened?
He was airlifted out.
No, I mean, you haven't said how you did your shoulder.
Oh, there. I fell over in the car park.
Come in. Thank you. Ah, I see it was a forceps birth. That must have been difficult.
It was a long labour. Then James went into distress, so they decided to pull him out.
Okay, let's have a look at him. Hello, young man. Do you want to put him on the bench? Look at you. Let me just turn your head. Oh, yep, the bruises seem to be healing nicely. Would you like to undress him? So, other than the forceps mark, is everything else all right?
I'm not sure. It's still a bit of a shock to the system. Breastfeeding on demand is another world.
How's that going?
It's a lot more painful than I realised.
Let's move these. Right, Sir James, I am going to weigh you, if that's all right. There we go. Now, they're a bit chilly.
I've been worried he's not eating enough.
Oh, I know. A few seconds. Well, he hasn't gained much, but he is growing. Okay, listen up. Let's get you back up again. Oh! There we go. You seem to be sweating a lot. Did you say your breast was sore?
Yes, but that's normal, isn't it?
Any headaches?
I'll probably get a bit dehydrated from the breastfeeding.
Right, well, if you'd like to get James dressed and put him back in his pram, I'd like to take a look at you. I think maybe you're the one who needs a closer look.
You know, it's funny. People say they're fine with a gay doctor, but when it's all brought home, their prejudices really come out.
It was a public kiss, rubbing people's noses in it.
It sounds to me very much as if you think there is something fundamentally wrong with two men kissing each other, regardless of where it happens.
That's not true.
Mac, we're partners. I would really hope that if you had any problem at all with anything in my private life, you'd come and talk to me about it.
I have no problems with your private life.
Good. Thank you for keeping your personal feelings to yourself.
I haven't got any personal feelings.
Okay.
Well, it's no wonder you've been feeling awful. You have mastitis, and I suspect an infection. You need to take a course of antibiotics.
Surely I can't take those while I'm breastfeeding. Will I have to stop?
They won't do the baby any harm, and no, you won't. In fact, actually, the best thing you can do is to carry on nursing.
I thought the soreness was supposed to be normal.
Only at first. But the fact that your milk ducts are blocked is probably a result of bad technique. Hannah, we run a breastfeeding support group. If you want to, you could come along.
What now?
No, now you need to start taking the antibiotics and get some rest. But the consultant is in today. I could ask her to pop in for a quick chat, if you want me to.
Yes, please.
Hey,
I'm looking for my wife, Hannah Fairburn. She came in this morning for baby clinic.
She's still in with Dr. Croft, I'm afraid.
Oh. Was there any chance I could go in?
I'll ask and see if that's okay.
Oh, well, don't worry if there's a problem. I'll just stick to hunting and gathering.
Yeah, well, no harm in asking. Hold on.
Try feeding more often and express between feeds if you feel uncomfortable. Warm compresses can also help.
Simon.
Hello.
Hi, I'm Dr. Croft. Barbara's just been giving Hannah a refresher course in breastfeeding.
Oh, great.
You can really help by making sure that Hannah doesn't try to do too much in the house. I'm sure you already are.
Oh, I know. I read somewhere that a lot of women give up on breastfeeding because they don't have the support from their partner. We plan to do the recommended 6 months at least.
I'm glad to hear it.
I wouldn't want James missing out on all the benefits.
I wish I knew more partners who had your attitude.
Oh, I do what I can. I'm just supporting Cast.
Nonsense. He's been fantastic ever since we got home and at the hospital.
Good for you.
Barbara, I was wondering, if we get home and there's still a problem, could we give you a call?
Of course. I do a lot of private work. Give me a ring anytime.
Thanks.
Simon, could you please not hover?
He doesn't look like he's feeding properly. Are you doing everything Barbara said?
I think so.
Did he get enough milk?
I don't know, he still doesn't seem hungry.
Well, shall I call Barbara?
I can do it. I just need to stick at it for a while.
You should have all the support that you need.
I feel like I'm burning. Have you been to the chemist yet?
Are you sure about these antibiotics? You know some of it will leak into the breast milk.
A tiny amount.
Here, there are still possible side effects.
The doctor wouldn't have prescribed it if it was unsafe.
Yeah, but I thought we agreed we were going to do everything with James naturally.
We did, I know.
Need a hand?
Thank you.
So, how are you feeling today? You all right being back at work and everything?
It's no big deal. It's a pulled muscle, a few cuts and bruises.
Not like you used to be so clumsy, though, is it? Must have had something else on your mind. Do you need me to change your dressing?
No, it's fine.
OK, if you're sure.
Thank you.
Have you got the antibiotics?
I thought we decided against that.
Simon, I really feel sick. I know it gets into the milk, but Dr. Cross says it'll be fine.
Just let me finish sorting this load. Oh, that'll be Barbara. I was coming to tell you. Come in!
Hi.
Hi.
Hello again. Still having a few hitches.
I guess so.
Don't worry. We'll sort something out. Where's the baby?
I'll bring him down.
Okay. Make sure you're comfortable. And supported. Now, if you just open your pyjamas, we can see what's been happening.
Shall I pass James over?
Thanks, Simon.
There you go.
Do you mind?
What's the problem?
Could I have a bit of privacy?
Oh, yeah, sure. I'm easy. How's it going?
He seems tired. He's trying to feed, but then either he just fusses or he suckles for a while and then falls asleep.
I think the problem might be your milk. It's quite rare, but sometimes with mastitis there's a high sodium content and it affects the taste.
It's been days like this. He won't starve, will he?
No, no.
What am I going to do?
Keep nursing, keep expressing. Or some mothers donate milk. I might be able to get some if you like.
Oh, I don't fancy that. Someone else's milk.
That would mean bottle feeding. Barbara, what do you think?
It's up to you. But if you use a bottle, babies soon figure out they don't have to work so hard to get the milk. He might not want to breastfeed afterwards.
You see? We don't want to give up just yet.
Let me know what you decide. I'm sure you and James will find a way.
We will. Thanks. Glad she came?
No, not really.
You better be at 60 quid a session. Anyway, at least you confirm we're doing the right things.
My mother would think we're crazy.
Well, your mother lived in the dark ages. She doesn't even know how to spell organic.
She'd be straight in there with the formula milk, drugs, no dithering.
James is going to have only the best. Everything natural.
There's that word again.
What's wrong with it? Hannah, women have been doing this since time began.
Don't you remember what happened at the birth? That was natural.
Yeah, I know.
And when my brother went on holiday and caught malaria, that was natural too.
Calm down.
Well, why do people keep saying natural as though that automatically means it's good?
Hey, shh. Come on. You're being negative because you're tired.
Am I?
Yes. Now, why don't you go upstairs with James and get some rest, eh?
Better wolf this down before the next group arrives.
Barbara, this is Nick and Jimmy. So, how are the ideal couple?
Well, she's still having some difficulty, but she wants to breastfeed exclusively.
I do not understand why women put themselves under so much pressure, especially when they've just had a major physical and emotional trauma.
That's the way they want to parent their child.
Yeah, but you could always use formula alongside breast milk.
Well, it's not for me to push it. Can you spare me the TV section? Thanks.
Barbara, you're not against using formula, are you?
No, not exactly.
So you didn't advise them not to use it?
I didn't want to.
But you did explain that Hannah could use the formula till she gets better and then go back to breastfeeding.
It's not always that easy to do.
So you didn't suggest it then?
Look, the advantages of breastfeeding speak for themselves. I just don't think it's a good idea to make it too easy for women to give up. If you're only having a small hiccup.
No. I'll tell you what a hiccup is. A hiccup is people pushing the pro-breastfeeding line onto inexperienced parents who what they really need is a fair idea of their options.
And that couple will be the first to sue when their baby develops asthma or eczema and they're looking around for someone to blame.
Except that Hannah is sick and justifiably concerned that her baby isn't getting enough to eat.
Like I said, it was their decision.
Right, well, just as well, eh? I mean, how much private work would you get if everybody just went around bottle feeding their babies?
He won't suckle. He's gone all listless.
He just looks tired.
His fontanelle's a bit depressed.
You're imagining the worst.
No, I'm not. I'm going to call Dr. Croft.
He said he could put off going to work for a couple of days and he's going to hang out here.
Oh, that's so exciting. Hey, we could all go out for a drink tonight. Are you doing anything?
I think we're up for it. If we can get a babysitter. Ronnie won't know what's hitting 2 nights out in less than a week.
I'll call Rika.
Oh, tell him all your embarrassing secrets.
You're right. He's a bit dehydrated.
Will he need to go to hospital?
No. But he will eventually if he doesn't get enough fluids. Do you have any other milk you can give him? Some you've stored?
Only a carton of formula my mother left here.
No way. Even one bottle would increase his risk of allergies or diabetes.
Only if there's a family history.
Besides, we don't want to use any kind of bottle if he won't breastfeed afterwards.
I don't think you have any alternative.
Donated milk, then?
I'd like to hear what Hannah has to say. Hannah.
I don't know.
What don't you understand?
I'm so confused. I can't breastfeed him. I can't bottle feed him. I don't know what to do.
baby, sweetheart.
Hannah. 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 You just fainted, that's all. How are you feeling now?
Bit shaky.
Will you lie there, get some rest? I'm going to make some sweet hot tea.
Thanks.
Oh, Hannah, what time did you start taking the antibiotics?
I didn't. I'm still waiting for Simon to go to the chemist.
Oh. What is that doing in the bin?
Oh,
Your wife just passed out. She needs that medication right now.
I know. I was worried about what might happen to the baby.
Oh, great. So if Hannah has to go to the hospital with an abscess, you'll be breastfeeding James, will you?
You're not still angry with Greg, are you?
Yes, I am, as a matter of fact.
Why didn't you talk to him this morning? I thought he apologised.
Yes, but for some reason, now I'm the one in the wrong.
You? Heaven forbid.
Well, he's managed to make the whole thing look as if I have a problem with his sexuality.
Oh, dear.
Political correctness. Because she's gay, I'm not allowed to object.
He apologised, Matt. Can't you just let it go? It was just a kiss, for heaven's sake, a romantic impulse. Surely you remember what it's like to be in love.
For what it's worth, I think you're making the right decision. Hannah, whatever anyone says, this is still a safe, nutritious alternative.
What if he rejects it? He might not like the taste.
He'll let us know.
What have you done?
It's the right thing to do for the time being.
She made a sensible choice.
You can't do this. How will we know this won't give him allergies? And what are you going to do if he gets nipple confusion?
Simon, I've had it with all these facts and figures. Whatever happened to common sense? I'm not going to sit by and watch him or me get worse.
I'm going to make a complaint.
Why? Because I wouldn't prescribe cabbage leaves. What exactly do you have against medicine?
There are so many risks. Side effects, long-term health problems. I don't want my baby to suffer.
But you're quite happy for your wife to.
She'll be fine. She's got me to help her.
Bully her more like when what she needs is support.
Look, I read the literature and everything said breast is best.
Yes, it is, if the mother is okay. She does have a say in this, you know.
Yeah, well, she didn't have a say in hospital, did she? The doctor was right in there. With all the students, the lights, the monitors, drugs, drips.
Simon, perhaps if they hadn't intervened when they did, neither Hannah or James would be here now. I'll leave you to it. Have you started the antibiotics? Good. They should only take a day or two to clear up, then you can carry on breastfeeding as before.
It's also stressful. I'm not sure I want to anymore.
Hannah, just do what's right for you, okay? I'll take one last look at James.
The formula's just for a while.
And then you'll go back.
Yes, but I won't promise for how long.
Oh, please,
I'm
Hannah.
not going to be bullied either way. It's my choice.
Right.
Is that it?
Yes.
No, that's not it. Where do I come into this? I'm not going to be like I was in the delivery room.
Like what?
When James's heartbeat dropped, I just had to stand there. All those people around you, and I couldn't do anything. I thought we'd lose him. I just wanted to make sure nothing bad ever happened to him again.
I'm not sure that's possible. Most of the time, we just do the best we can. James is rosy now. He'll be fine.
Yeah. Well, thanks for coming over.
You're welcome.
And Scotland, I love. The mountains, the wilderness, it's so powerful. It's almost mystical.
You see, your job just sounds amazing. You get paid to travel the world, see beautiful places, stay in wonderful hotels and write about it. And you call that work?
Yes. But sadly, my guide is coming to an end. I have to find a new project soon.
Oh, over here. That'd be great, wouldn't it, Greg?
You don't get me that easily.
Oh, come on. Are you going to stick around?
Yeah, come on, Rico, spill the beans. Greg won't tell us anything. How did you meet?
They're certainly very open about it.
Oh, why shouldn't it be? Just look at Greg.
Come on, it's great news. It's Greg and Rico.
Greg and Rico.
So it's not just ships in the night.
No, that's the real thing. I know a man in love when I see one.
Who?
So, he invited me for a romantic walk on the beach. The palm trees, the stars, the moon glistening on the water. And then he tries to kiss me. But he's so drunk, he trips on my shoe and falls in the sand.
Right, well, this is just about my idea of hell. Around.
I'll give you a hand. Well, I must say I approve.
I'm pretty pleased with the situation myself. Mate, 2 beers and another bottle of Merlot, please. I can't quite believe this is happening.
Are you okay?
Yeah?
You're falling for him.
Oh, I fell for him a long time ago. You know, when I got back from Goa, it just didn't feel like it was over, you know, and now he's here.
Oh, I'm so happy for you.
Oh, best feeling in the world.
Next year on BBC1, Monk risks everything to find out why someone would murder a prisoner on death row.